Celiac disease is an autoimmune condition where the ingestion of gluten leads to damage in the small intestine. It affects millions worldwide, often causing digestive discomfort, nutrient deficiencies, and a range of other symptoms. While genetics play a significant role, environmental factors also contribute to the risk. In this video, we'll explore evidence-based strategies to help lower the risk factors for developing celiac disease, especially for those with a family history or genetic predisposition. Understanding these basics can empower you to make informed choices for yourself and your loved ones. The primary risk factor for celiac disease is genetic predisposition. Certain genes, specifically HLA-DQ2 and HLA-DQ8, are strongly associated with the condition. However, not everyone with these genes develops celiac disease, indicating that other factors are at play. Knowing your genetic risk can help you and your healthcare provider monitor for early signs and symptoms, especially if you have a close relative with celiac disease. While you can't change your genes, understanding their role is the first step in risk management. Gluten is a protein found in wheat, barley, and rye. For those at risk, the timing and amount of gluten introduced into the diet may influence the likelihood of developing celiac disease. Research suggests that introducing gluten neither too early nor too late in infancy may be beneficial, but there is no definitive guideline for complete prevention. Moderation and monitoring are key, especially in children with a family history of celiac disease. How and when infants are introduced to gluten may impact their risk for celiac disease. Some studies suggest that breastfeeding during the introduction of gluten might offer a protective effect, though evidence is mixed. The current consensus is to avoid both early, before 4 months, and late, after 7 months, introduction of gluten. Instead, introducing small amounts of gluten between 4 and 6 months, while continuing to breastfeed if possible, is considered a balanced approach. Breastfeeding has long been studied for its potential to reduce the risk of autoimmune diseases, including celiac disease. While some research indicates a possible protective effect, the evidence is not conclusive. However, breastfeeding offers many other health benefits for both mother and child, so it remains a recommended practice during the period when gluten is introduced into an infant's diet. Certain infections during infancy and early childhood, such as rotavirus, have been linked to an increased risk of developing celiac disease in genetically susceptible individuals. Maintaining good hygiene, ensuring timely vaccinations, and seeking prompt medical care for infections can help reduce this risk. While not all infections can be prevented, minimizing exposure and supporting a healthy immune system are practical steps. Emerging research highlights the importance of gut health and the microbiome in autoimmune diseases, like celiac disease. A diverse and balanced gut microbiome may help regulate immune responses and reduce inflammation. Consuming a diet rich in fiber, fruits, vegetables, and fermented foods can support a healthy gut environment, potentially lowering the risk of celiac disease and other autoimmune conditions. Frequent or unnecessary use of antibiotics in early childhood can disrupt the gut microbiome, potentially increasing the risk of autoimmune diseases, including celiac disease. It's important to use antibiotics only when prescribed by a healthcare professional and to complete the full course as directed. Supporting gut health after antibiotic use with probiotics and a balanced diet may also be beneficial. Beyond genetics and diet, environmental factors such as pollution, stress, and exposure to certain chemicals may influence the risk of developing celiac disease. While research in this area is ongoing, adopting a healthy lifestyle, minimizing exposure to environmental toxins, and managing stress can contribute to overall well-being and may help reduce autoimmune risk. If you have a family history of celiac disease, it's important to be aware of your increased risk. Discuss your family history with your healthcare provider, who may recommend genetic testing or regular screening for celiac disease, especially if you develop symptoms. Early detection can lead to better management and improved long-term health outcomes. Early recognition of celiac disease symptoms can lead to prompt diagnosis and treatment. Common symptoms include digestive issues like diarrhea, bloating, and abdominal pain, as well as fatigue, skin rashes, and unexplained weight loss. If you or your child experience these symptoms, especially with a family history of celiac disease, consult a healthcare professional for evaluation. Managing celiac disease risk is best done in partnership with healthcare professionals. They can provide personalized advice based on your risk factors, monitor for symptoms, and recommend appropriate testing. Never start a gluten-free diet without medical supervision, as it can complicate diagnosis and may not be necessary for everyone. While a gluten-free diet is essential for those diagnosed with celiac disease, there's no evidence that avoiding gluten prevents the disease in healthy individuals. Unnecessary restriction can lead to nutritional deficiencies and may not lower your risk. Focus on a balanced, varied diet unless medically advised otherwise. A well-balanced diet supports overall health and may help reduce the risk of autoimmune diseases. Ensure your meals include a variety of whole grains, lean proteins, healthy fats, fruits, and vegetables. This approach not only supports gut health but also strengthens the immune system, providing a solid foundation for disease prevention. Vitamin D plays a crucial role in immune function. Some studies suggest that adequate vitamin D levels may help reduce the risk of autoimmune diseases, including celiac disease. Safe sun exposure, fortified foods, and supplements if needed can help maintain optimal vitamin D status, especially in children and those at higher risk. Chronic stress can negatively impact the immune system and may play a role in triggering autoimmune diseases. Incorporating stress management techniques such as mindfulness, regular exercise, and adequate sleep can support overall health and potentially lower the risk of celiac disease. Regular physical activity is associated with a lower risk of many chronic diseases, including autoimmune conditions. Exercise helps regulate immune function, reduces inflammation, and supports gut health. Aim for at least 150 minutes of moderate activity per week for optimal benefits. Smoking is a known risk factor for many autoimmune diseases and can negatively impact gut health. Avoiding tobacco products is an important step in reducing overall disease risk and supporting a healthy immune system. Moderate to high alcohol consumption can disrupt gut health and immune function. Limiting alcohol intake is a practical way to support your body's defenses and may help lower the risk of autoimmune diseases like celiac disease. Obesity and being overweight are linked to increased inflammation and may contribute to the risk of autoimmune diseases. Maintaining a healthy weight through balanced nutrition and regular exercise supports immune health and overall well-being. Probiotics are beneficial bacteria that support gut health. Some studies suggest that probiotics may help regulate immune responses and reduce inflammation, potentially lowering the risk of autoimmune diseases. Including probiotic-rich foods like yogurt, kefir, and fermented vegetables in your diet is a simple way to support gut health. Prebiotics are types of fiber that feed beneficial gut bacteria. Consuming a diet rich in prebiotics, such as those found in whole grains, bananas, onions, and garlic, can help maintain a healthy microbiome. This, in turn, supports immune function and may lower the risk of autoimmune diseases like celiac disease. Highly processed foods can negatively impact gut health and increase inflammation. Limiting processed foods and focusing on whole, minimally processed options helps support a healthy gut and immune system, which may reduce the risk of celiac disease. Staying well hydrated is essential for digestive health. Water supports the movement of food through the digestive tract and helps maintain a healthy gut lining. Aim for adequate fluid intake each day to support overall wellness and potentially lower autoimmune risk. Some medications, especially when used long-term or unnecessarily, can disrupt gut health and immune balance. Always use medications as prescribed and discuss any concerns with your healthcare provider. Avoid self-medicating, particularly with antibiotics and anti-inflammatory drugs. Vaccinations protect against infections that may trigger autoimmune responses in susceptible individuals. Keeping up with recommended vaccines, especially in childhood, is an important step in reducing the risk of celiac disease and other autoimmune conditions. In children at risk for celiac disease, monitoring growth and development is crucial. Unexplained growth delays, weight loss, or developmental concerns may be early signs of celiac disease. Regular checkups with a pediatrician can help detect issues early and ensure healthy development. Celiac disease can present with symptoms beyond the digestive tract, such as anemia, joint pain, headaches, and neurological issues. Being aware of these non-digestive symptoms is important for early diagnosis and management, especially in those with a family history of the disease. For individuals with a family history or other risk factors, regular screening for celiac disease can lead to early detection and intervention. Blood tests, and, if necessary, biopsies are used to confirm the diagnosis. Discuss screening options with your healthcare provider if you are at increased risk. Celiac disease is one of many autoimmune conditions, where the immune system mistakenly attacks the body's own tissues. Understanding the basics of autoimmunity can help you recognize risk factors and take proactive steps to support your immune health. Both genetics and environmental factors contribute to the development of celiac disease. While you can't change your genetic makeup, you can influence many environmental factors through lifestyle choices, diet, and healthcare practices. This dual approach offers the best chance for risk reduction. To lower the risk of celiac disease, focus on evidence-based strategies. Maintain a balanced diet, support gut health, avoid unnecessary antibiotics and medications, manage stress, and stay physically active. For those with a family history, Regular screening and early symptom recognition are crucial. These steps, while not guaranteeing prevention, can help reduce risk and support overall health. There are many myths surrounding the prevention of celiac disease, such as the belief that a gluten-free diet can prevent the condition in everyone. Evidence does not support these claims. It's important to rely on scientific research and consult healthcare professionals for accurate information. If you or your child experience persistent digestive symptoms, unexplained weight loss, or other signs of celiac disease, seek medical advice promptly. Early diagnosis and intervention can prevent complications and improve quality of life. Even if you are at increased risk for celiac disease, you can lead a healthy, fulfilling life by making informed choices. Focus on overall wellness, stay proactive with regular checkups, and maintain open communication with your healthcare team. Knowledge and prevention go hand in hand. If someone in your family is at risk or has been diagnosed with celiac disease, your support can make a big difference. Encourage healthy habits, help monitor symptoms, and foster a supportive environment for dietary and lifestyle changes. Together, you can navigate the challenges and celebrate successes. Many communities offer resources for those at risk for celiac disease, including support groups, educational workshops, and access to dietitians. Taking advantage of these resources can provide valuable information, emotional support, and practical tips for managing risk. Medical research on celiac disease is ongoing, and recommendations may evolve as new evidence emerges. Stay informed by following reputable sources, attending educational events, and maintaining regular contact with your healthcare provider. Raising awareness about celiac disease and its risk factors can help others recognize symptoms and seek timely care. Advocacy efforts also support research and improve resources for those affected. Sharing knowledge benefits the entire community. Registered dietitians are valuable partners in managing celiac disease risk. They can provide personalized nutrition advice, help plan balanced meals, and support healthy eating habits for the whole family. Consulting a dietitian is especially helpful for those with dietary restrictions or concerns. Ongoing research continues to uncover new insights into the causes and prevention of celiac disease. Scientists are exploring the role of the microbiome, environmental triggers, and potential therapies. Staying engaged with the latest research can help you make informed decisions about your health. Taking charge of your health means staying informed, making evidence-based choices, and seeking support when needed. By understanding your risk factors and adopting healthy habits, you can play an active role in lowering your risk for celiac disease and supporting your overall well-being. Lowering the risk of celiac disease involves a combination of genetic awareness, healthy lifestyle choices, and regular medical guidance. While not all risk factors can be controlled, focusing on what you can change makes a meaningful difference. Remember, prevention is a journey, not a destination. Celiac disease risk can be managed through informed choices and proactive care. By staying educated, supporting gut health, and working with healthcare professionals, you can take meaningful steps to protect yourself and your family. Thank you for joining us on this journey to better health. For more information on celiac disease risk and prevention, consult reputable sources such as the Celiac Disease Foundation, local healthcare providers, and registered dietitians. Accessing reliable resources and support networks can make a significant difference in managing risk and living well.